Hi, my name's Kirsty, and a year ago I was diagnosed with pheochromocytoma. And this is my story. I should go back to 3.5 years ago. I was living in London and I was suffering with attacks that would wake me up at night. It would start off with palpitations, sweating, feeling of fear, and it would creep up my chest into my head and cause a horrific headache, pulsing, thumping, so severe that it would make me throw up. These attacks came pretty much consecutively every night, and I went to my GP eventually, who referred me to a neurologist. The neurologist MRI scanned my brain, he tested my heart, and he was pretty nonplussed as to what the problem was. He diagnosed me with cluster headaches. It seemed to be most fitting at the time. And I was given greater occipital nerve injections into the base of my skull, which essentially numbed the nerves and provided some relief to a point. But these attacks did continue for 6 months, and I was convinced I was having a nervous breakdown. So I, in fact, packed up my life, gave up my job, and I went travelling down under, which is something I'd always dreamed of doing. And I ended up down here in New Zealand, which is now where I live. So since I got to New Zealand, I didn't have any more attacks, and I put it behind me as a period of stress that hopefully would never happen again. Until a year ago, I was fairly healthy, and then I started getting UTIs, recurrent UTIs, urine infections, for 6 months. Constant trips to the doctor for the same problem, and eventually I just got so fed up and I put my foot down with my GP and said, look, this needs to be investigated. So she put me forward for a ultrasound scan of my kidney, and my kidney was fine, but it was being squashed by a 10-centimetre tumour sitting above my kidney and behind my liver. At that point I was referred to a surgeon who put me forward for an MRI scan, which confirmed characteristics of a pheochromocytoma. I'd never heard of that word before. I didn't know anything about it, so it was quite a shock, quite a steep learning curve, finding out about something that I'd never heard of. And after that he then referred me on to a liver specialist, because the location of the tumour being behind the liver, the surgery was going to be quite tricky. So he forwarded me to Adam Bartlett, who is a liver surgeon here in New Zealand, and I had excellent care from him. He did some blood tests and some urine tests, which confirmed that the pheo was a functioning secreting tumour. I had 10 times too much adrenaline in my system. So he introduced me to his anaesthetist, Paul Gardner, who dealt with me during the surgery. It turns out that a pheo resection is not the simplest of surgeries for an anaesthetist to deal with, because the nature of it being like a sponge full of adrenaline, when it's manipulated during surgery, it means that it can fire off huge amounts of adrenaline into your system, and that can then in turn cause your blood pressure to spiral out of control, which can potentially be lethal unless it's dealt with properly by the anaesthetist. So what they do is they block the patients beforehand. So you take beta blockers and alpha blockers for a period of time before the surgery until they're happy with your levels and they're happy to go ahead with the surgery. So that's what I did, and surgery went ahead on the Monday. And I was very lucky. The surgery was a lot easier than had initially been planned. So my liver had to be taken out and put up in my upper left quadrant while they worked on the tumour underneath. The tumour was growing. There was a small tongue shape of tumour growing into my IVC main vein. So that potentially could have been an issue and a bit of a drama to repair, but as it turned out, the tumour came away quite easily, and it was relatively easy to repair. And the tumour was completely encased in its own membrane. The adrenal gland was completely lost in there somewhere, and the tumour was then sent away for pathology. I woke up in ICU, and it was quite frightening, to be honest. I wasn't prepared for the kind of state I'd be in, and so I I woke up and I had a central line in my neck. I had an epidural in my back. I had 3 or 4 lines coming out of each arm and hands. I had a catheter. I had a pain pump. I was in a lot of pain, but the pain pump did help to a point, and obviously the epidural blocked my sensations to a point too. But it really was quite frightening, the state I was in. I could hardly move when I woke up. I was drifting in and out of consciousness. I was looked after in ICU for 2 days while my noradrenaline levels came down, and once they were happy with that, they sent me down to the ward for me to recover down there. I was down there for another week. It was a week from hell. I had to overcome a lot of challenges that week. I had to start walking with a Zimmer frame. I could hardly stand up straight, and because of the location where the surgery had taken place, it was so near to the lungs, so it causes issues around your lungs. So breathing is an issue, and talking, even laughing, not that you feel like laughing much, and standing up straight, sitting up. It was just a lot of pain. So I had to. It took a long time for me to get strong again in hospital. Even I was completely dependent on the nurses. They had to shower me. I didn't expect to be in such a state. It really was quite an experience. I had my dad and my fiance James with me in hospital. They sat by my bedside pretty much all day long, helping me through. I got better. I did get better, and I left hospital feeling a hell of a lot better than I started off there. And I got home and tried to do my walks every day, tried to do my breathing exercises, but for some reason my pain wasn't getting better. I was taking more morphine. I went to see my surgeon, and he said there's something not quite right. I had all this pain in my back. I couldn't lie down. The pain was consuming my thoughts. I couldn't concentrate on anything. And he knew that something wasn't quite right. So he forwarded me for another ultrasound scan of the area where the tumour was taken out. Everything was fine in there, but my lung did have fluid in it, which was probably causing the pain. Well, it was causing the pain. I had a blood test which confirmed there was an infection, so I would have to go back into hospital to get this fluid drained off. So I ended up in hospital for another 5 days and had this drain, which was a really unpleasant experience. I won't go into it. But there's also the worry of why the problems were occurring in my lungs. So that they did various tests, and the C word looms in your brain again, and you start to worry. But I was all clear, and it was simply fluid. And once it was gone, I felt so much better. It was such a relief. I got home, and all of a sudden my recovery started to speed up, and I realised that actually my body was going to get back to normal. It was such a relief. So here I am a year on, and all I'm left with really is a scar which goes from my sternum down to just above my belly button and across. It's quite a big scar, but really little, considering what the dramas that went on there. And I do have a few ongoing health issues which I'm dealing with, but it's to be understood, having been through so much. The physical side of things get better, however the mental side of things are a little trickier. I do find it quite difficult to make peace with everything I've been through, and a year on I'm doing a lot of reflecting on what was happening to me this time last year, so it's very much in my mind at the moment. I see an endocrinologist regularly who's been organising my MRI scans. I've had 2 clear MRI scans now, which is great, and he has done genetic testing. I've had 3 genes tested: RET, SDHB and SDHD, and he believes that there's no need for further testing because there isn't a family history of this disease in my family, seemingly. However, I do find that difficult to make peace with, because I do know now that there are lots more genes, and is it irresponsible not to investigate these genes? I've got a family that could be exposed to this. I would like to have my own family one day. I'd like to have children, and if I'm lucky enough to have them, is there a chance I might have a gene that I could pass on to them? So this is something that I do need to work out whether it's worth investigating for my own peace of mind more than anything. Because of the genetic testing coming through negative so far, he's labelled my endocrinologist has labelled my tumour as sporadic. It's a term that I find very difficult to understand. Sporadic means no genetic link, no real reason it was there, it's unexplainable, random. Well, I find a 10 centimetre ball of unwanted cells being there at all, I find that very difficult to explain as random. There must have been a reason it was there, there must have been a reason it grew. And what if it was there once, how could it not be there again? So I do worry, of course, that it might recur. I'm hoping that I am a sporadic case and that I am one of the large percentage of people with VOs who don't get it back. I really do hope that my endocrinologist is right. However, I think with further genetic testing, I would make peace with this a little bit easier. I think the reason I'm making this video is because I would like to help towards the knowledge and the research of this rare disease. I am 1 in a million apparently who have this type of tumour, and because there's such low numbers of people relatively in the world who have had it, there is limited research and there's so many unknowns. I found it very difficult when I was first diagnosed to find much information. There's a lot of general information out there, but not a lot else really. I found it hard to connect with anybody else, and since then I've found ways of connecting with people who've also had this type of tumour or who have the ongoing disease. And it's comforting to know and to understand other people who've been through the same thing. So I think putting this video together and sharing lots of different stories from around the world is invaluable. It's something that will help to raise awareness. When I was going through those attacks in London, I had no idea what was happening to me. If I'd heard of pheochromocytoma, I think I would have asked my neurologist to check me out and scan my abdomen, find out if there was a tumour growing there. However, I'd never heard of it, and even if I had heard of it, a 1 in a million case, I wouldn't have even guessed that I would be that. So raising awareness will help hopefully people in the future who might have similar symptoms, who might have the headaches, the sweating, the feeling of fear, the horrible attacks that I was getting back then that I didn't understand. Hopefully they will, having this knowledge, they will be able to ask for the right tests, and people will not have to go through such unknowns like I did. Thank you for listening to my story.